for people to join. Give people a few minutes. All right. All right. Well, I have top of the hour here. Shall we dive in?
Let's do it.
All right. Well, hello, everybody. Welcome. This is Pelvic Floor Health and Menopause 101 with Genevieve. And we are here today with two amazing women who are doing the work of educating women all about menopause. So before we dig in and make introductions, I'll do a little bit of housekeeping really quick. You know to put your comments, your questions in the chat box, and we will do our best to get those answered for you. And then we're going to keep this a tight 30 minutes so that you can get in and out of this and get the answers that you need. So I'll be time checking and keeping us on the clock. I also want to give a special shout out to Melanie Olson, who could not be with us today, but worked so hard to bring these people together and to produce this content. So let me introduce you. Got a little bit of background noise there. Of course, it happens right then. All right.
So facts, yes, making all the noise. Shut that down.
Yeah, right on. Okay, well, so today we have Kerry Boysen here. Kerry has over 25 years of clinical experience in orthopedics and pelvic health physical therapy, and she's the owner of Restore Physical Therapy in Corvallis, Oregon. Also, very importantly, Kerry has completed over 300 hours of education specific to pelvic health physical therapy, and that includes education related to menopause. So a true expert here on this topic. And she is joined by Stasi Kasianchuk. Stasi is our director of coaching here at Genevieve, and she has over 10 years of experience as a registered dietitian nutritionist and lots of other fascinating background. And she leads our practice here with our registered dietitians and lifestyle care. So I am Britt Stromberg, and I'm the Chief Marketing Officer at Genevieve. I have also been a patient of Genevieve's for over 2 years. I have worked with both our RDNs as well as our doctors. I've worked with a couple of different doctors. I am postmenopausal, and I am so excited to be here today because one of the symptoms of being postmenopausal for me is that I feel like I always have to go to the bathroom. So tell me more. What is going on? Why? How can I fix this?
You are not the only woman who has asked that question, and I hope everyone who's joining us today, your questions beyond that, go into that chat room, because I assure you what you are experiencing, you're not the only one. Nothing here is taboo to talk about, right? We're gonna talk about all these things. I'm excited to be here and have this conversation because I am weirdly passionate about the pelvic floor. And the pelvic floor, I got introduced to kind of in the childbearing years, and as I have aged and am now perimenopausal, moving towards menopause, there's just so much that we can learn and know, and sharing that with the world and everyone is my passion. So I always carry my pelvis with me, and I'm going to start just with, here's your pelvic floor, because I think we hear pelvic floor, we hear Kegel, we hear, well, if you just do these exercises, well, what does that even mean? And how do we even connect to that? So this is your pelvis. You can see kind of back side, bottom side. We'll just turn it around here, kind of looking down from the top. And this is your pelvic floor. So the pelvic floor is layers of muscle and connective tissue, and their job is to give support to your pelvis, give support to the pelvic organs that sit in here. Of course, we have a uterus and ovaries, we have a vaginal canal, we have a bladder and urethra, we have descending colon and rectum, lots of things that sit in this space. And all of these have estrogen receptors on them. All of these connective tissues have estrogen receptors. So as you start to have decline in estrogen, there are impacts on these tissues.
Thanks. That's good. That's such a great overview, Kerry, and it makes me think of, as my team and I are working with patients, we often get questions about perhaps some symptoms they're experiencing around their pelvic floor in that area that, and like you mentioned, there's a lot of things there. So sometimes it's trying to discern what is causing what. But I think one of the gaps that a lot of patients in their menopause transition aren't aware of is that connection to that decline in estrogen actually having an impact on muscles or tissues. The vaginal tissues may make more sense, but thinking about actual muscles of the pelvic floor doesn't always connect. So I'm glad that you called that out. And that's certainly going to be a lead up into some of the other things that we talk about.
Right. And it's the whole musculoskeletal system in general is impacted. And this is part of that musculoskeletal system, right? It makes sense that we might lose muscle mass in our bicep or our quadriceps because that's our muscles. These are also muscles that can also start to lose elasticity, start to lose some mass. And when that happens, there's less support for those organs, or there are tissue changes that can lead to some painful experiences. When we're talking about pelvic floor function or dysfunction, pretty much falls into two categories. There's either a overactive pelvic floor or an underactive pelvic floor. Underactive pelvic floor presents like incontinence or perhaps pelvic organ prolapse. So that's when these muscles aren't really doing what they're called to do. They're not giving support. They're not sealing off the urethral opening, vaginal opening. We can also have fecal incontinence. They're not doing their job. They're not supporting the organs. They're not sealing off. That can be because they've thinned. That can be because they're less elastic. It can be because they don't have that same muscle bulk. So there are hormonal influences that we can do menopause hormone therapy to improve tissue health. We can use a topical estrogen, or coming to see the pelvic floor PT, we talk about how do we exercise these muscles? How do we engage them properly? How do we get them to contract? How do we get them to relax? How do we get good blood flow to keep those tissues healthy? The overactive pelvic floor is often in response to a painful condition where perhaps there's been ongoing inflammation. There could be a history of inflammatory things happening, bladder irritation, even think about painful periods, endometriosis historically, where those muscles have just decided to be in a state of tension. Then add in some of those changes that happen with menopause. Now, all of a sudden, it burns to urinate. It is discomfort or pain with intercourse, and those muscles respond by tightening. So now we're in an overactive pelvic floor state. How do we identify that, and how do we get those tissues to relax?
And would you say, Kerry, in those scenarios, that background is helpful for the patient, though? Is that something that they need to discern from, or is that where they come to you to help them determine that?
My experience is that some women have an intuition, right?
Mhm.
They'll often know, like it doesn't feel like it's working. I don't feel like I can identify those muscles. I don't know how to do a Kegel. I've been told to do it, but I can't feel that I'm doing it. So having a pelvic floor therapist do a pelvic floor exam and get a sense of what is happening with those muscles and being able to give the feedback of, yeah, actually your pelvic floor is in an overactive state. This might be why you're experiencing pain with intercourse, why you're constipated, why you might feel like you're retaining urine, or gosh, that pelvic floor just is not doing what it's supposed to do. It's why you're leaking when you cough, sneeze, laugh, run, jump, lift the weights in the gym. And can we get those muscles on board? Or that sense of, I had 3 babies. I've had a job where I've done a lot of heavy lifting. I literally feel like something's falling out, which is the symptom associated with pelvic organ prolapse. What can I do to help give support to those organs? How can I just improve the health there?
Mhm.
So, and a lot of times women come and think they're doing a pelvic floor contraction, think they're doing a Kegel correctly, and they're not.
Yeah, no, that's such a great point. And, I'll share from my perspective, my own experience that I am working with peri and postmenopausal women and hearing some of their symptoms that they were reporting and recognizing their need to have a pelvic floor assessment. I also got curious about where is my pelvic health at? And also had some experiences where I had the need to go to the bathroom, but I couldn't always fully I never felt like I could fully empty my bladder. So sought out pelvic floor care at that time and learned a lot just from even the preventative standpoint, just learning more about that physiology and being able to connect the tissues and the muscles that are down there with how I was feeling and having that explained to me, which was super helpful even from a preventative standpoint. That being said, on the prevention side, I hear a lot of patients, and whether it's just out in the media or patients that I work with, that will say, "Oh, I do Kegels every day." Like that's my pelvic floor. They've never had an assessment, but we hear do Kegels, and so they're doing them as they think they should. Can you give us the pros and cons of Kegels, and what would you recommend if someone wants to proactively support their pelvic health, or how to best go about that?
I think doing Kegels is a great idea. I tend to use the terminology pelvic floor contraction versus Kegel just because Kegels typically we've been cued maybe to stop the flow of urine or stop gas from passing, which is kind of that squeeze. There's this whole inner layer of that pelvic floor. So we've got like a superficial layer, which is the squeeze, and then we've got this inner layer, which is more of the lift. So the joy that I have when I'm working with patients is helping them understand. I mean, for a lot of women, they've never even been aware that we have this musculature. They're not aware of its connection to the core. And this sits at the bottom of our core. So we have the pelvic floor at the bottom, we have the diaphragm at the top, we have our deepest layer of abdominal muscles, which kind of spans across here and then wraps around. And then the deepest layer of back muscles, the multifidi, which go from one vertebra to the next. So that's our core. Then we've got some other, external layers, glutes, things that can feed into that, adductors. But the core of the core is those four muscle groups, and they're connected fascially. So nothing sits in isolation. So I don't just look at the pelvic floor. I'm looking at, hips and spine, and then what is happening with this core. So a cool thing to know is the diaphragm and the pelvic floor, they work together. So if I can get somebody to connect to their breath, in the case where that pelvic floor is overactive, we're trying to get that to relax. Well, with our breath, if we inhale, the pelvic floor lengthens. If we exhale, the pelvic floor shortens. So being able to make those connections. So it's somewhat beyond Kegels, if you will, and it's being able to connect to those muscles, feel those muscles, develop that mind-body connection, tie it into our breath, and then functionally be able to incorporate that into our activities of daily living, right? Are
Mhm.
you caring for young ones, lifting? Does your job require you to transfer patients or do heavy lifting? Are you at the gym doing CrossFit workouts where your body needs to absorb impact? What's happening with those muscles? So figuring out how to connect it to the system and then understanding, well, how many should I do? So your question of like, is it good to do Kegels? Yes. In the case of an overactive pelvic floor, if you are working on tightening, 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 that's not going to serve you well. That's going to create more tension that can lead to more constipation, more urinary retention, more pain with intercourse. So learning to identify, oh, it's actually in a state of tension. Can I get that to relax is really critical. So if you feel really confident, and obviously if you're not having any pelvic floor dysfunction symptoms, right? You're not having any incontinence, you're not having any pain, you're probably doing fine. But if anything just feels a little bit off, that's a great time to have your pelvic floor examined.
That's a great point. Well, you mentioned some of the lifestyle activities, which I think is important too, right? Sometimes people will say, okay, I'm doing my Kegels or I'm doing my pelvic floor exercises, done, check for the day. When really the goal is that pelvic floor, from what I understand from you, it's working all day long.
Right.
We want to think about incorporating that into other activities, which you talked about. How does someone think about that, and doing that when they're lifting groceries or even sitting down and getting up, some of these everyday activities or walking or running? Is that possible to do?
Yes. And there's that fine line between obsessively thinking about your pelvic floor with everything you do, which of course that's my bias. And, I probably think about it more than the average Joe, but I like to cue women into, I mean, its job is to bring stability. Its job is to give support. It works with the core. So when you think about activities that you've been cued to engage your core, maybe that's with a lift of some sort or a push or a carry. Maybe that's with your abdominal crunch exercises from the gym. A lot of group exercise, they'll cue like engage your core. I say engage your pelvic floor, right? Pelvic floor comes online first, and then that core kicks in. So if you are, and then that tying to the breath. So on an inhale, I know my pelvic floor is lengthening. On an exhale, I want it to lift and shorten and give support. So I often cue people to just incorporate that into that lift at the gym with your breath. So on an inhale, you take your breath in, and then on the exhale, you engage your pelvic floor, do the move, do the exertion, right? So typically we're breathing out when let's say we're going to do an overhead press, we're going to like exhale as we do that. So engaging your pelvic floor. And with a lot of those activities, like I said, people have already been conscious about, I'm going to engage my core, which can feel like a drawing in of the abdominal muscles. That can actually work against you. So people will say, I leak when I'm at the gym. Okay, I'm doing a lift, on the press, I feel like I leak a little bit. Well, that if you're engaging your pelvic floor and or holding your breath, it increases the intra-abdominal pressure, and that can create a pressure that can cause a leak. So can we counteract that by exhaling? And can we counteract that by engaging our pelvic floor? So those are opportunities with some of those functional activities to try that. Again, lifting groceries, lifting the laundry basket, pushing the vacuum, setting up the Christmas tree, any of these, like, the daily things that we do. For me, it's like the dog food bag, hoisting that. Can I engage that pelvic floor? Exhale as I do it.
This is kind of blowing my mind that we're not connecting the pelvic floor muscles to the core.
Yeah.
I mean, I'm 51 and I'm just hearing this for the first time. So I feel like that's a pretty big moment here that I'm personally having. Like, oh, okay, because you just gotta add a little extra bit there down at the bottom.
Right. And as we're sitting here, I mean, I can't help but talk about my pelvic floor and engage it. Right. When I'm saying this. And so people ask, well, how many do you do a day? I'm like, well, kind of all day long. When I'm educating other women about this, I'm thinking about it. But when you can feel that in your body, can't you, Brett? Like if I do a pelvic floor contraction, if I do a Kegel, if I think about that, my lower abdominal muscles, they kick in. I can feel those engage. But if I just draw my belly button in or just engage my abdominals, my pelvic floor is not really doing much. Like, how do we get those systems to work together for optimal benefit? This is the most fun part of my job, is being able to connect women to this and have those aha moments and make it all work. I would say it's not rocket science. It's just being able to engage.
Mm-hmm.
Yeah, I also just feel like there's a missing ingredient, and we don't need to get into why, but just that connection we're not talking about that. And And to your point, Stacey, women can do things, or women can stave off some of those symptoms that come as you go through the menopause journey much earlier with this knowledge.
Yeah. Yeah. And I think the knowledge too, coming back to even, around some of Genev's mission of really filling that gap of knowledge. But when you know something, you have that like, oh, this is why I'm leaking. Oh, and there's something I can do about it. All of a sudden that there's a little bit less fear, right? There's a little bit more permission, there's a little bit more empowerment around that. And I think the pelvic floor for so many who may not be aware of it can be key to so many of their symptoms, and that they're going through related to their menopause journey, and just almost kind of open, like you said, Britt, blow your mind of
Mhm,
like, wait a second,
mhm.
this is all that's happening down here and can be supported, whether it's through physical therapy, whether it's through medications, combination, or so forth.
Right.
Mhm.
I loved what you said, Stacey, about like it feels like as we're going through this journey, there's that piece. This is something we can control. So much of the menopause experience for me, this perimenopausal roller coaster, feels out of my control. It is out of our control, right? Our bodies are doing what they're doing as far as hormone levels changing. And I can't necessarily control that. For somebody who loves control, that's been a challenge. But knowing like, oh, I do have power through knowledge of my anatomy, how my body works, I do have some control over that. The other, back to the beginning, Britt, where you said, like, I feel like I have to go to the bathroom all the time. That just by doing Kegels, you're not going to correct that, right? Then we're talking about what is the tissue issue.
Mhm.
Oftentimes, my experience is some women, because they are now post childbearing, because they had a pap smear 5 years ago and it was fine, they're not getting gynecological exams. When I do the pelvic floor exam, I am looking also at the external genitalia, the tissue health. Like, I may be the first person to identify you're having some thinning of these tissues. That thinning, the dryness, the decreased elasticity, that is what's impacting these genitourinary symptoms, the burning, the potential pain with intercourse, the discomfort there. Like, there has been a tissue change, and there's great ways to support that. I think Stacey and I have talked, there's like multiple webinars that could come just out of what are we doing for that tissue health. But I think that's where the referral to the genetic providers, is a topical estrogen going to be beneficial? Most likely, yes, to
Mhm.
help plump up those tissues, to get some more estrogen back there. That alone can be helpful for the urgency feeling, the frequency feeling. There's non-hormonal topical options for just helping moisturize the tissues, lubricate those tissues. So it's a tissue issue, and then it is this like muscle control issue that both need to be addressed.
Can you take both hormone replacement therapy and do the topical vaginal hormones?
Yes, I am not a prescriber, but working with other providers, you can, topical estrogen can also be used because that's directly affecting the tissues. It's not having the systemic effects.
Mm.
So another, whether it's a patch or it's oral or it's a cream, other hormones can be on board also.
Mhm.
Yes.
Okay.
Yeah, and I think, it comes back to as well, again, the toolbox that we want to build and the multifaceted approach, that the impact of these hormones, and Carrie did a great job talking about and reminding us that, yes, there's estrogen receptors in these tissues, but there's estrogen receptors in all the muscle tissues. There's estrogen receptors throughout the body. And so we'd be naive to think that a decrease in estrogen is just impacting places on our body. And
Mm.
luckily, there's more conversations about that now around the learnings of the impact of that decline. But on the flip side, if that decrease in hormones is impacting systemically, it also requires a multifaceted approach to address all of the symptoms. And that's
Mhm.
where I think that collaboration with a pelvic floor physical therapist, your gynecologist that has menopause experience, the dietitian that is going to help you target the lifestyle pieces, like really build that team, and
Mhm.
remind all everyone that's listening that you or your partner who or your friend or your sibling that might be going through this does deserve that. I think oftentimes, especially in Carrie, we was even mentioning, if you haven't scheduled regular gynecological care, let alone any level of additional support for your health, it can feel hard to say, now I'm going to schedule this appointment. I'm going to ask this person for help and I'm going to commit to these things if it's not something you're used to. But again, I think, what we've talked about here today just really highlights how a team based approach is an investment in yourself and your future health.
Mhm. Well, and accessing pelvic health physical therapy, I can't tell you how many times I have heard, wait, you're a physical therapist and you do what? And you're just knowing, like all of you listening today, now you know if you didn't
Mhm.
before, there are pelvic health physical therapists.
Mhm.
In my practice, it's obstetrics and pelvic health, right? We are women kind of across the continuum. It is intimidating for somebody to come and have a pelvic floor exam. Like that can be, like what is going to happen? And so I love to educate women before they come. I also highlight it's not a gynecological exam. There aren't stirrups, there's no speculum. It's more comfortable. 99% of the time, somebody is walking out the door saying, that went way better than I thought. That was so amazing. Just the education around what is our pelvic floor, what does this mean for my life and how my genitourinary system, my GI system functions.
Mhm.
So if you have any hesitation, I would really encourage you to just step out in some confidence that it's really going to empower you. It's not going to be scary. Not all providers are created equal. Vet your provider, but there are we're pretty special pelvic floor physical therapists in what we do.
Well, we have just a few more minutes. I haven't seen any questions pop up in the chat, so please do post those if you want Kerry or Stasi to answer those before we wrap up. Any other thoughts?
Why were
Stacey,
we?
I was going to ask you, so when you had pelvic floor physical therapy, were there any major aha moments? How did that, because you're not in your perimenopausal journey yet. I mean, I love to see women, postpartum start this foundation of
Mhm.
education. So where were you at in your journey and how was it helpful?
And I will say I'm not in my perimenopausal journey that I know of, but as we learn, it's a continuum. So
Right,
there may
right.
be things that happening underlying. But I will, I like I mentioned, one other aspect was my mom, and she was in her 70s at the time, but she did have a prolapsed uterus and bladder. And listening to her symptoms and her talk about that, and granted, there was like time, there's years between us, but I was like, if I can, that does not sound
Mhm.
pleasant. And if I can do something now that can decrease my risk of that, um, I'd like to. And so there was some of that as well. And I would say what surprised me the most, and this comes back to the core exercises, was how, based off of the assessment of my first time with pelvic floor physical therapy, the assessment of the weakness of my pelvic floor. And I am someone who is active. I enjoy exercise. I have a background in exercise physiology and personal training. And I was, kind of like, oh, I thought I had good core strength, right? And so you're thinking of those things and not connecting the two and not being as intentional. So initially it taught me to be more intentional with connecting my body to my core. And then postpartum, after I had my daughter, I was a little bit more curious of like, is what just happened down there, and what are the and has my body healed from that, several months out. And so
Yeah.
that's when I came to see you, Carrie, and it was helpful to even in that appointment to connect. I had hip pain, and I did not put that together on in terms of a pelvic floor weakness. I just thought, oh, hip pain, like there's a muscle that's tight there, or I tweaked it. And so to be able to learn how to engage the pelvic floor to then increase the support for the hip muscles, which aren't that far away, was again that mind body connection that is so powerful.
Yeah, I know I'm such a visual person, but when we come back to it, right, your hip fits into
Mhm.
the ball of this socket. There's a muscle that comes off your hip that connects to the pelvic floor. When you think about, lumbar muscles coming down, glute muscles, like so much is impacted by the pelvic floor. As pelvic floor physical therapists, we used to sort of be at the back of the clinic behind closed doors with patients. And over my 25 years in this profession, the pelvic floor, I mean, it's showing up in the sports medicine and the orthopedics worlds. Like, oh, yeah, this is a pretty important piece that we shouldn't ignore. So, yeah, making that connection can be really empowering.
Well, ladies, our time is up. That went by so
So
fast.
fast.
I still have questions, mind's still blown, but I want to respect our time. I want to thank both of you so much. This has been mind expanding. And for those of you listening, please know that you have support. You do not have to suffer alone.
Mhm.
You can come to Geneva. You can book an appointment with Stasi or with our other clinicians. Usually in under a week, we can get you in. So whether you need to see a doctor or a dietitian or both, we're here for you. We also have an amazing Facebook community, and that is Menopause Solutions by Geneva. There are over 8,500 women in that community who are sharing stories, getting help, supporting each other. So check that out too. We're also on the social channels. So please also feel free to reach out to Kerry Boysen. Thank you, both of you. This has been phenomenal. I hope our listeners have learned something new today, and have a fantastic rest of your day.
Thanks, Brett.
So
Thanks,
thank you.
Stacey.
Bye.
Bye.
Bye.